Hello, this is Scott. So a couple of weeks ago, I did an educational session on HEDIS, and I covered several things there, and it was really about some considerations that you have as far as purchasing technology to cover HEDIS, with two main themes: the visual analytics and then also the advanced analytics for HEDIS. So I got some response that it was it was meaningful in that sense, but some people wanted me to go a little bit deeper into the dashboards and not go through so fast because I covered a lot of material. If you want to check that out, you can. There's a PowerPoint as well as some slides that I covered. So I wanted to just make a very brief video to cover about 4 pages for analytics that I have here. And so first, as a perspective as a care manager or as someone responsible for care management, what might be a meaningful dashboard for them? So I'm talking about specifically HEDIS, the diabetes section of HEDIS, things like eye exam, foot exams, hemoglobin A1Cs, neuropathy. For those type measures, one view is certainly a map view where you have your data and you have where your panel is by zip code, and you can look real quickly at what measures are performing and where you have patients that you need to bring into the clinic. So here I've got eye exam opportunity by zip code, and green means we are those patients are have been seen in this time period for an eye exam, and then the red means that they have not been seen. So you can see here this particular zip code that I'm at 100% compliance ratio is 100%. There's 20 people in here, and all of them have had their eye exam. Here, if I click on this little red sliver here, then I can see here that I've got 4% within this group of 25 people total, and they have had their eye exam. And when I click on that, it cascades down to this details on demand section, and I can see the medical record number and some stats for this individual person. They're 73 years old. They have BMI of 2250, and these are quite configurable, whatever information that you want. But important information is they have no care manager right now. So we probably need to get them and brought into within a management program and assign them a care manager here. Their primary care physician, and that primary care physician is internal medicine. And again, 0 means that they haven't had an exam. So that's just a quick panel for someone that's actively involved into care management. I can look here at this panel and I can see some of the other metrics. Here I'm looking at care manager. I have 3 care managers here, and then I have foot exam compliance. So this is where I have no care manager assigned, or it's unknown. And so I can see my compliance rate for foot exams is about 86% and just over 14% for non-compliance. This particular care manager with their group of patients is at 90% compliance. This care manager, 91% compliance, and this care manager is 100% compliance. I can also look at, well, things like, does a care manager certification make a difference? And so I can create dashboards like this for that type of information. I can also look at how long a patient has been under the guidance of a care manager. Here, and this is a different measure. This is the neuropathy compliance. But here, 52% are non-compliant if they have no care manager assigned to them or it's unknown. A care manager, they've been assigned to a care manager less than 3 months, is basically 47%. A care manager less than 6 months is 3.3%, and then you can see the impact there. So again, these are highly configurable dashboards. A last one that might be interested in is you can visualize the number of primary care visits over the last 24 months and how that impacts compliance for foot exams. Here I'm looking at foot exams, and I can see that this group here, that they've had no primary care visits within the last 24 months. A couple other ones. Let's see. We can look at eye exams across a self-reported metric. So these are aggregate measures for activity level, self-management knowledge, self-belief, self-efficacy, and social support. I can see here that those people that this is unknown, which really means that they don't have a care manager that actually provided the self-reporting mechanism, that these rates are typically higher. We've got a little bit of an anomaly here where they do have a care manager, but they scored very low. They scored themselves very low on that particular metric. And so you can see that this ratio, this percentage of red, which means that they did not have an eye exam, is kind of high. And then as they rate themselves higher through this self-metric, we have a higher compliance rate. So that's another thing that can be done here. And then just to lastly follow up, you can do all sorts of measurements here. You can look at relationships within these dashboards, and everything is clickable. I can hover over this particular measure and see that, and I could find that measurement in the table, et cetera. This is a male, family medicine, et cetera, that with a really high BMI. But I also have this details on demand, so I know exactly what MRN that is. They have again a very high BMI of 38. They're 48 years old. They do have a care manager, and that care management under 3 months for this particular patient has been under care management, and they have not had their eye exam. So, another thing that I could do here is I can start a conversation, and I could say, Anna, here's a diabetes patient with BMI 38, no foot exam. This is a note that I previously created, obviously, but I can stick that there, and then when Anna comes in to this panel, she can just click on that and see that I've left a note for her. So it's quite collaborative. So hopefully this has been good for you, and shows you a little more in depth what I covered previously. And just to flash it real quick, if you have questions, or you can contact me at work or where I teach and ask questions. So that's a couple email addresses that you can reach out. Thank you very much for your time.